in Wuhan, China, 2019, and like wildfire, is spread across the globe. We all thought by now the storm would be over, but apparently the world is still battling with the second wave of COVID-19. Well, the good news has been the discovery of vaccines, including the Oxford ASTRAZENECA vaccine, which has recently been approved by NAFDAC. And that's what we're looking at this morning, COVID-19 prevention, NAFDAC approval of ASTRAZENECA vaccine. And our guest this morning on the program is no other person than Dr. TOMI, Commissioner for Health, Ogun State. You're welcome to the program.
Thank you very much.
You're welcome once again. So, yes, we do have an update that NAFDAC has been able to approve this vaccine for Nigeria. But then the question from most Nigerians is, when will these vaccines arrive the country?
Thank you very much once again for inviting me onto the program. It is good news. I'd like you to take you back about a year ago. Tomorrow is the anniversary of the first case of COVID-19 in Nigeria, arriving in the index case and in Ogun State. So it's very exciting. My guess is we'll probably get the vaccine this weekend. That is my guess. There's no indication yet, but from the schedule that the federal government had given us, we were expecting the vaccines to arrive at the end of February, and we are at the end of February, just a couple of days to go. So hopefully in the next 48 hours, we may actually have signs of the vaccines arriving in the country.
Well, I'm aware that Ghana has taken delivery of COVID-19 vaccine. Yesterday, South Africa has administered it on about 32,000 health workers. They are projecting that by the end of March, about 1 million people, 1 million South Africans, would have been given shots of this vaccine. Senegal also have taken that of China's vaccine, the kind of vaccine they produce in China, basically. So why the delay in Nigeria?
Well, there is several layers to deal with when you are delivering a vaccine program. So Nigeria has been planning. They've been training. We've just completed our training of the trainers yesterday. So for the last 4 weeks, the federal government, the National Primary Healthcare Development Agency, has been cascading training, and they formed a technical working group which involves planning and surveillance, the safety of the vaccine, and also risk communication. So they're working behind the scene. It's not like we're not doing anything. But by the time the vaccine arrives in Nigeria, I believe we would be set and ready to hit the ground. The tentative rollout date is actually 15th of March as we speak. So it's not far away. That's a couple of weeks. So we're not completely sort of inactive. There is some work being done in the background.
Okay, so now, yes, let's say March the 15th, we are able to start vaccination, but you've talked about training, but then our logistics like right now, our logistics like in getting the vaccines to where they need to be, and also you remember that earlier in the year there were some we call it misinformation, or let me call it misinformation in the sense that we heard that, okay, we do have enough storage in order to store all of these vaccines in the country when they do arrive, and we heard from some quarters also that we don't have enough storage. But from your own perspective, do you believe that we do have enough storage facility to be able to store all of these vaccines as they arrive in the country to sustain their potency?
I absolutely believe we have enough storage, that the cold chain is in place for Nigeria. I think the misinformation came as to what type of vaccine we're going to use. If we were to use the Pfizer vaccine, which requires minus 70 degrees storage, then we may not have been able to meet this. But the country has decided to actually use the AstraZeneca Oxford vaccine, which is stored at +2 to +8 degrees. And this is the same logistics that was used for the polio vaccine, which has recently been eradicated last year. So if, we have everything in place. We have the SDD, which is the solar direct drive freezers in almost every primary health care center in this country. and all the states have their own cold room, working cold room. So that logistics is already in existence, and we hardly have to invest any more money to achieve that.
Well, we have other brands, we have Moderna, we have Pfizer-BioNTech vaccine. Russia also has produced a vaccine. We have the one from China, which Senegal took delivery of recently. So now NAFDAC has approved ASTRAZENECA. So does that mean that going forward we also have other types of vaccine coming into Nigeria, or this is the only vaccine we have?
As you know, there are several vaccines that are being manufactured and at different stages of their manufacturing. The ones that have been released, the first one was the Pfizer, Moderna, then ASTRAZENECA, and also the Russian one came. Each one has different storage requirements. So there will be a plethora of vaccines later on as the disease goes on, because this is a phased implementation. In the first instance, Nigeria is going to receive about 58 million AstraZeneca vaccines that will be distributed. And this will be provided from 4 major suppliers, which is the COVAX, and MTN is giving some. There's the Indian government also is donating about 100,000. Then there's the African Union Commission, which is given quite a large amount of the vaccines as well. So this is the first phase, and Nigeria's aim is to vaccinate 70% of the eligible group by the end of this year, and the 30% that is left will be vaccinated next year. Who are the eligible groups? The eligible group is the age 18 to and above, age 18 and above, and that would include pregnant women and obviously pregnant women, and that number is 108 million odd people, 51% of the population thereabout. So we will still continue to need vaccines, and depending on availability, because as you know, the entire world is competing for these vaccines, and also depending on the supplier. You know very well that South Africa is now got the license to manufacture the Johnson & Johnson. It may well be that later on down the line, we might choose to use Johnson & Johnson. And why would that be? Because Johnson & Johnson is a single-dose vaccine, whereas AstraZeneca, Moderna, Pfizer is a 2-dose vaccine, which might prove a logistic nightmare for Nigerians because they might not be compliant. They might take the first dose and then not present themselves, because if people don't know the importance of returning for the second dose, and the second dose is to be given about 12 weeks later. So, there are different reasons why different countries would choose different brands of the vaccine. But the key message is take the vaccine that is accessible and available to you as soon as possible.
Okay, well, many thanks. Let's take this breather. We'll be back shortly.
I protect you, you protect me.
I protect you,
you protect me.
I protect you,
you protect me.
The face mask has dual purpose. First, it stops you from infecting the other person by catching your droplets. and it stops you from infecting yourself by touching your eyes, mouth, and nose. I protect you and you protect me. Wear your face mask.
This message was brought to you by the Ogun State Government.
Welcome back. Well, we have another guest in the studio. I'm talking about Lawrence AYELABOLA, Chairman, Pharmaceutical Association of Nigeria, Ogun State Chapter. You're welcome to the program.
Yeah, thank you very much.
Welcome to the program, Mr. AYELABOLA. So we've been talking about, the fact that the ASTRAZENECA vaccines have been approved for Nigeria. NAFDAC have done that already. But so I want to ask these questions from NAFDAC right now. We have seen that in South Africa they were given the opportunity to be able to develop the Johnson & Johnson vaccine over there. And we heard that we were able to get some clearance earlier in the year that we could, begin to, sort of develop our own vaccines here in Nigeria, through NAFDAC. From your perspective, do you think we can get to that level in a year or two?
Yes, thank you very much. There is no reason why we should not do it. If we as a country we are prepared, even if you have in March, nobody will have believed that we'll have a vaccine by December, because the process of vaccine production is more stringent. But by December we had one, we had Pfizer. So Nigeria coming into the line of production of biologicals is possible. But one thing is that the government must have that political will to push it through. There are some things that WHO will ask for. We don't have them right now in Nigeria, unfortunately. Well, these are things that are standard, apart from the financial commitment. The Nigerian government, the president is making an arrangement for like 10 billion naira investment into vaccine production. But there must first be clearance by WHO. One, is our regulators ready? Talking of NAFDAC, is the country, the regulations of the country concerning pharmaceuticals, is it in place? Do we have the law? Do we have an act of National Assembly that can push this thing through? We don't. We've tried it before. They asked for the PCM bill. It was weak. Now it's been in the National Assembly. It's been delayed. That's why we are saying, let there be a passage of the Pharmaceutical Council of Nigeria bill. This bill regulates so many things. Because biologicals are not things that WHO plays with. Because the whole world will suffer for it. So it's very feasible.
Mm-hmm. Okay, well, Commissioner, on paper, Nigeria should vaccinate about 70% of her population before the end of the year. But can we put this off? I mean, looking at our facilities, yes, Mr. AYELABOLA made some statements as regards capability.
One thing we tend to forget is if any continent is prepared to deliver vaccines and immunize its citizens, it will be the African continent, because we've always carried out routine immunizations. Every month, every year, there's about 4 routine immunization exercises happening on our children and sometimes our mothers, pregnant women. So we have the healthcare workers to do it. We have the logistics. We have the know-how, the knowledge, because we've always done this for many years now. So actually, the European countries and developed countries are looking towards Africa to learn how we've been able to maintain routine immunization for millions of people over the years. For instance, in the last 1 year, Ogun State has immunized over 1 million children. And you didn't hear any song and dance about it. It's what we do. We do it naturally. So Nigeria is poised and is able to do this, and we have to trust our leaders that they will deliver on this.
Okay, Dr. Hooper, I want to ask this also. You spoke about, the people that will be vaccinated once this vaccines get into the country, saying, okay, people between the ages of 18 and above. But then I believe that there will be some specifics, people that will be, put on top of the ladder, prioritized above others.
There are 4 priority groups. The first priority group are health workers and frontliners. Frontliners include, public-facing people, people at petrol stations, trays, all the service individuals. So those would be the priority number 1, group 1. Priority group 2 are people with underlying conditions, and anybody above 50. Those are 2 and 3. And then you have the third, would be the second phase. The third phase will involve local governments that are hotbeds, where we know that the largest numbers are coming from. For instance, in Ogun State, that would be Shagamu, Adodota, and Abeokuta South. Then lastly, phase 4 would be every other person that hasn't fallen into those 3 previous groups that I mentioned.
Okay, before I come to you, Mr. Ayelabola, I want to also clarify, how would identification be done? Because, we might have people that would, want to come up and say that, oh, I'm an health worker, whereas they are not, authentic health workers. Give us an idea of what we put in place to make sure that, okay, you are who you say you are.
So what the government has been able to, what they're going to do is roll out some pre-registration, electronic pre-registration before you can get your vaccine. So in the e-registration, they'll be able to check maybe your NME number to make sure that you are who you say you are. In that pre-registration as well, what that helps us to do is the planning, proper planning, to know exactly how many people are going to be vaccinated and to avoid wastage. So if the people that are not able to pre-register themselves, there will be ability for people to go house to house to register them online. So there's a lot of logistics that's been put into surveillance. There's an application which the government has invested in. Okay.
Well, Mr. Ayelabola, Oni of Ife has unveiled a local COVID-19 remedy approved by NAFDAC, and I also know that over 30 herbal medicine currently undergoing review, for listing. How challenging is this?
Yeah, we cannot jettison our natural products. That's the truth. They have a place. But the truth of the matter is that we as a responsible government and as professionals, we need to ascertain the efficacy of these things. Let me give you a practical example. We all know over the years, we all know dongoyaro, that it's been used to treat malaria. But over time, over the years, we've taken it as a clinician, we've taken it to the lab, we've checked, and we've seen that our popular dongoyaro is not different from paracetamol. So if you say you're having malaria, you don't take anti-malaria drugs, you are taking paracetamol, there's a little bit of relief after a while, you calm down. So we have to start telling the people in the herbal industry that, okay, this is more like this. So why don't you add some more concoction to it to make it work? So even, take for example, still on malaria, look at the main drug that we're using, ACT. It's about base. So what we are saying is that, yeah, anybody can come up. I can come up and say this thing can work. And on the lighter mode, we've seen a prominent person in Nigeria saying that when he tested positive for COVID-19, he was treated with amala and get healed. Do we say it works? So that is where the place, because NAFDAC will test essentially about for safety. Essentially for safety. That what if you take this drug, even if it's not going to help someone, hope is not going to cause the damage. Essentially, because NAFDAC is safeguarding the health of the nation. So if someone now comes after, I have my O4, I have my number, it doesn't really translate to efficacy. That's what I like. Because when it comes to all this, as a pharmacist, I'm trained on both herbals and orthodox medicine. So we should just understand that.
But the local remedy I talked about has been approved by NAFDAC.
Yeah, that's what I'm saying. It can be approved because it is safe.
I guess what he's saying is they've tested the safety of the drug. And maybe there is a need, the next step is now a trial, what you call a double-blind control trial, which means the person that is administering the drug and the person taking the drug don't know, is it water I'm taking or is it this herbal remedy? And then when they looked at the outcome, maybe after a period of time, you unblind it, then you find out that did this thing really make a difference?
So NAFDAC approval is not the final step.
No, even with NAFDAC, there's a unit called the Pharmacovigilance Unit. Even after approving a drug and gets to the market, periodically they check what is out there. So the fact that a product is approved does not mean that it cannot be listed.
Okay. So, Dr. Coker, let's dovetail our discussion, to Ogun State now, and I want you to talk more. How prepared are we, for this vaccine?
Okay. As early as I think the last week of probably the second week of January, we actually put together a committee for COVID vaccine, because we knew that we had to start looking at our logistics. Under that, we had the coordination, the planning team, we had the surveillance team, that how many people do we actually need to vaccinate, sorry. We also started talking about risk communication. What I'm doing here is actually risk communication and demand creation, because we're letting the public know about the vaccine. It's going to be here. So Ogun State is prepared both by, the manpower, the logistics. We have our cold room. We've done gap analysis of our cold chain to ensure that end to end our vaccines are at the right temperature. From the point we get it from the federal government, arrives in the state, it goes into our cold room, from our cold room to the local government, and right down to each ward, and from each ward down to each facility. We have that cold chain intact, and we have the healthcare workers that would deliver the vaccination process.
Okay, I want to also, up on this particular point, which is about misinformation. We had a particular Catholic bishop coming out to say that, getting inoculated with COVID vaccine is not a sign of 666. We have heard a lot of misinformation online. So what's Ogun State doing as per misinformation?
So there are many misinformation out there, and this is the beginning. We are starting to address that. We have disease surveillance and notification officers out there. We're listening out for rumor. Our epidemiology team are listening out for rumor. We've always done that since last year, since COVID broke out. We try and address them. We are going to take to air, radio, posters, and have engagement with stakeholder groups where we're telling them the benefits and demystifying all the rumors as to it's not a 666, so you're not being labeled, there's no chip there, because it is
sustainable for Nigeria to decide to, pay for the entire, vaccination of the population.
Yeah, that's more developed countries